I'll take care of that.
And it says we're live. It says we're live and without any technical difficulties, which is really great. Hello, everyone. It's Tuesday, 4 o'clock Pacific, 5 o'clock here in Costa Rica, 1 a.m. in Italy, 8:30 and 9:30 a.m., depending on what part of Australia you're in, Wednesday morning, and it's Facebook Live. And it's the first of the month, so it's great because I get to be with Michelle Ross, our Director of Clinical Services. Yeah. Right?
Hey, Dr. Tom, so happy to be here. And we get to talk about two of my favorite topics. Yes,
we do. And it's a topic that most people don't know about, but I think it's one that'll change the course of people's lives when they understand it. And that is, I see Eileen is the first one on, and she's got a map here. Eileen, is this the map of Costa Rica? Is Costa Rica green and white and orange? Is that right? I can't tell what country your map represents, but it's nice to see the map there. Thank you so much. And as you join us, tell us you're here. Send us some little like thumbs up kind of things and say hello and where you're from, because it gets me going and keeps me fired up when I know that we're reaching people all over the world, and it's really great. So today's topic is one that, once again, not many people know about, but here's the bottom line. 250,000 people a year die in the US from this, more than everyone that dies from breast cancer, prostate cancer, and HIV put together. 250,000 people a year in the US die from what's called sepsis. So we're going to talk a little about how does this set up, because this is a decades-long process that accumulates in the body. And we're going to talk about this mechanism, and the notorious component of this is called LPS, stands for lipopolysaccharides. So Michelle, can we start with what is LPS?
Yes. In fact, I had a consult today and he said, can you just give me like the 60-second elevator speech? My wife wants me to, she thinks I have LPS. I don't know what it is. And I thought, where's Dr. Tom when I need him?
Well, 60 seconds doesn't happen very often, but...
But so critically important, right? And it's so amazing way, right? Yeah. That it's a maybe chronic UTIs, some kind of chronic infection in the body that's now leaked into the bloodstream, and the body's like, uh-oh, this is for these gram-negative bacteria.
We'll get to the testing. Let's start off, I'm thinking, if I don't know any bone cells, skin cells, organ cells, brain cells, add them all up, and there's 10 times more cells of bacteria than the number of human cells. And we all know that genes turn on function or turn off function. Like if you've got a gene for plugging up your pipes and cardiovascular disease, if that gene gets turned on, you plug up your pipes quicker than somebody else will. Now, and so genes determine function. And the bacteria has 100 to 150 times more genes than our human genome. And we know there's about 23,000 genes for humans, but the number of genes in our body from bacteria is pretty close to 3 million. 3 million different genes, and genes turn on function. So when you understand that, and Michelle and I have made jokes many times in the past, are we humans with a lot of bacteria, or are we bacteria having a human experience, right? I think the first time Michelle and I met, we had dinner at a conference, and I think we talked about it there.
Such nerdy functional humor.
Right, two geeks together. But it's really true. It's really true that bacteria in our body run the show. They've got their hands on the steering wheel of where your body's going. And the geek term for that is modulates. And that in itself is a big deal for people to get, because we think of bacteria as bad things. Ooh, bacteria. But they really are friends as long as you have more good bacteria than bad bacteria. And that's what we're going to get to today, and how important it is, because it kills 250,000 people a year in the US when you have too much of the bad bacteria. But first, we have to get that bacteria control function. It's the bacteria in our body. You've heard me say before, for every one message from the brain going down telling the gut what to do, there are 9 messages in the gut telling the brain what to do. That 1/3 of all the small molecules in the bloodstream at any one time, 1/3 of them are messages from the bacteria in the gut. It's like exhaust from the bacteria in the gut, turning on genes all throughout the body. How your heart functions, how your eyes function, how your gallbladder functions, how your brain functions. It's controlled, hands on the steering wheel, it's controlled by the bacteria inside our body, much more than being controlled by our own human genes. Much, much more. Michelle, do you want to add to that?
No, that was excellent.
Okay.
Great.
Okay. Laura's watching. Hey, Laura. Laura Danaher has joined us. And, maybe it's my phone, but I've only got 2 people that have made, comments here. And I can see there's like hundreds here. So if you guys are out there, just tell us where you are. And it might be my phone's not registering it for some reason. I don't know. Michelle,
that it's frozen, that it's buffering. Hi, Laura. So nice to see you.
Okay.
She's on the team, the DRTOMOBRYANGLUTENFREE team, but now they're saying it's coming back and forth, but there's definitely people here. So welcome. We're grateful that you're all here.
Okay, so if it's fluctuating in and out, it might be being here in Costa Rica that the power goes out about once every 2 days for a minute or 2 minutes, or sometimes for 20 minutes. And sometimes it's when there's a storm, sometimes there is no storm. So Michelle, if I get dropped, you'll of course just take over with this. Okay, so we've got this back. That's the first thing to get, is that we are more made up of bacteria than we are of human cells. 10 times more bacteria than human cells, 10 times. And once again, that bacteria has its hands on the steering wheel of how our body functions. So and that's such a paradigm shift for people. It takes a lot to wrap your head around that, and then to live from that understanding. That's the key part, is, all right, okay, maybe, okay, whatever. But do you change your lifestyle to accommodate the majority of who's driving the car in our body? And that's why when you hear us talk about everybody needs a little bit of fermented vegetables every day, everyone needs a little root vegetables every day, that's why, is because you got to feed this good bacteria. Michelle, you want to add to that?
Yes, and I just wish we all knew that from early on. Like, it's so, do people know about your news, or? Okay, I won't bring that up. Eddie has.
It's okay to bring it up. I'm sorry, she was just telling me something. Yeah, no,
okay.
Thanks. For those that don't know, I think I announced it last week, but Marzi and I, we've got a bun in the oven. We've got, we're pregnant. We're about 15 weeks pregnant, and everything is great. Marzi gets to just rest and sleep a lot, and I'm very grateful that we're here where we are, where there's less stress right now. Although it's new bacteria for us here. There's a lot of new bacteria when we're in the jungles of Costa Rica. We're literally in the jungle. Monkeys are howling at about 5 in the morning every morning, about a house or 2 away usually. If they're right by us, in the trees by us, it's really loud. It's louder than an alarm clock. But usually they're a little bit away, so it's not that big a deal. So we're really happy about that. Thanks, Michelle.
Yeah, that's wonderful. And so exciting that this new baby, once you start introducing food, that you'll have all this knowledge to create this healthy microbiome from the get-go. And Eddie, who's with us helping to host this, has some little ones, and it just makes such a difference when you have this knowledge and you can help to create that. And you don't have to start them with the standard American diet, right? Or processed baby food. But sometimes people feel like failures because now their gut is kind of messed up and they can't handle the fermented food. So don't feel like a failure. Just know that you might have to do some gut healing before you get to the fermented food, or you may have to start with the tiniest little piece. And then each day add in a little bit more. If you're having a histamine reaction, it might not be appropriate for you right now. Work with somebody who's knowledgeable about it. You'll get there. The body has the most amazing capacity to heal.
Right. And the good bacteria want to be dominant in your gut. They really do. And most of us, unfortunately, don't have a lot of dominance of the good bacteria right now because we grew up on Mountain Dew and Three Musketeers, or Kit Kat and Kool-Aid, or whatever it was for you. Way too much sugar, way too much processed food, which kills the good bacteria. And now, unfortunately, we've got glyphosate. Any vegetables that are not organic have glyphosate residue on them. And glyphosate doesn't harm human cells, but it kills the bacteria. And it will cause intestinal permeability because of that. And then you got the leaky gut and all the problems of that from the glyphosate. More and more important as we learn and read more science that everyone is growing their own spices at home on the windowsill. Grow your own parsley, grow your own rosemary. If you can do a garden, do a garden. If you can do a garden on the deck of your patio because you're in a condo, get the tubs and just grow tomatoes outside there. And the more of that kind of food that you get, and you'll notice the difference in how it tastes, the more next year, maybe I'll have 2 tubs out here and I'll grow some lettuce, or whatever it should be. But we have to head in the direction of healthier foods because the inorganic foods is contributing to the problem we're talking about today, which is sepsis. Because the inorganic foods will contribute to developing intestinal permeability, the leaky gut. And so let's go back to LPS. Let's go back to what this thing is. Okay? LPS, lipopolysaccharide, is the exhaust of gram-negative bacteria. It's the remnants, if you will, and we've all got this bacteria in our guts. It's not really supposed to be there. A little bit of it's okay because it's exercising our immune system, making sure the immune system stays strong. Every once in a while, it's got to fire some chemical bullets to destroy these invaders. And that's a good thing in the gut, to have that. It's like exercising a bicep. You want strong muscles, you got to use them once in a while. You want a strong immune system? Well, that's why there's a little bit of bug that's not good for us on most of our food. And there's no way to sterilize for that. Everybody gets exposed to it. But when you lose the protective environment of the intestines, because you've wiped out too much of the good guys and there's too many of the bad guys, then what happens is you get the leaky gut. And when you get the leaky gut, now, everyone remembers, I hope, that the inside of the intestines is lined with cheesecloth. And only really small molecules can get through the cheesecloth to get into the bloodstream. About 500 nanometers and smaller. Really, really tiny, tiny little molecules of proteins or carbohydrates. And our digestive system breaks down these molecules into really small things that go right through the cheesecloth. But a leaky gut is when you get tears in the cheesecloth, and then bigger molecules can get through. And it happens to most of us every day to a minor level, and for many, unfortunately, to a more than minor level. When you get the tears in the cheesecloth, what happens is this exhaust of gram-negative bacteria which is about 60,000 Daltons in size. And remember, anything larger than 500 is not supposed to get through the cheesecloth. But now 60,000 Daltons, this LPS stuff, and it goes right through the tears in the cheesecloth into the bloodstream, into the submucosa, then into the bloodstream. Your body says, what am I supposed to do with this? And your body has to address this. It has to fight this. It has to produce ammunition in the immune system to take out the LPS that's not supposed to be there. And this happens every single day. At some point, you lose tolerance to LPS. Michelle, I just downloaded 5 papers yesterday on LPS tolerance.
Oh, wow.
I know. You see her eyes? You see Michelle's eyes? That's what a geek does when we hear a new concept, and I'm the same way, right? So scientists are actually writing now about LPS tolerance, that there's a certain amount of this LPS that we can handle, and it's part of life. We're going to get exposed to a little of it. But when you cross over from the tolerance level of LPS, whatever that level is, when you, for you as an individual, and everyone's different, but when you cross over that tolerance level, now your body says, your immune system says, no more, no more. And no longer do you just have the guards like firing a bullet every once in a while, just keeping it in check. Now the guards say, we're overwhelmed here. We need reinforcements. And then in come the big kahunas called antibodies to LPS. And when you get elevated levels of antibodies to LPS, you got a problem. You got a problem because LPS causes a leaky brain. You've heard of leaky gut, you get a leaky brain. And when you have a leaky brain, tears in the cheesecloth of the brain, these LPS molecules can get into the brain. And then the antibodies have to fight those things. And when they do autopsy on people who have died of Alzheimer's, and they do autopsy of the brains and look at that beta amyloid plaque under microscopes, it's full of antibodies to LPS. That your immune system has been fighting this LPS in your brain, causing inflammation, and the plaque that forms is like the brain's Band-Aid trying to block this stuff off so it can't develop anymore. It's much more technical than that, but that's kind of the idea of what happens with this LPS. Now, sepsis is the accumulation of too much of this LPS making you sick. Elevated antibodies. Now, as Michelle said, UTIs, urinary tract infections, recurrent pneumonias, recurrent sinus infections, any type of infection, ear infections that come back again and again, you're loaded with LPS. And why? Because it's bacteria and the exhaust of the bacteria. And this stuff accumulates for most of us for years and years and years. This is what killed my mother, was sepsis. And it's not a fun thing to watch, just like Alzheimer's is not a fun thing to watch at all. And the way you prevent this is by reducing the tears in the cheesecloth so you can't get more of this LPS into your bloodstream. That's the bottom line. And you have to detox. If you've got elevated antibodies to LPS, it means you've lost tolerance, and this stuff is accumulating in your body. Where? Well, it accumulates in the spleen, it accumulates in the kidneys. Maybe you get bladder infections because it's accumulated in the bladder. It accumulates in the sinuses, it accumulates in the brain. It just depends on the individual where this stuff is accumulating over the years, and you feel fine. You think you're fine, but you're really not. This stuff is accumulating, and now you have elevated antibodies, and so you are creating more inflammation to fight this stuff and try to get this stuff out. But the lifestyle causing the tears in the cheesecloth in your gut continues. You're still eating commercial cucumbers or commercial carrots or commercial broccoli that's sprayed with this stuff, with these glyphosates and these insecticides and pesticides that cause the tears in the cheesecloth in our gut. When you start, Michelle, do you want to add to that?
Oh, it's going to be smart alecky and say what everybody's death certificate says right now, but I'm going to keep this on air. So I'm not going to say that. I feel like everyone's just getting labeled with a virus right now as their cause of death, even if they didn't die of that. So right. I'm back on track. Sorry.
That's a really good point. That's a really good point. And I'll just say it though, what Michelle is referring to, there have been articles that come out that have said a person's in the hospital and they die of cancer, then they test them to see if they had COVID, and then they changed the death certificate to say they died from COVID, or they died from COVID and cancer. So it's increasing the numbers of this virus, and it's happening all over, and doctors are being told, many doctors have been on YouTube and Facebook saying, I've been told by our administrators we have to do this. And I don't believe in this. And so you hear it again and again and again. So let's not get into politics too much, but that's just an FYI for everyone, that there's a lot of weird things going on right now about this pandemic that we're in. But let's go back to our topic at hand.
Back on track. Yeah. Yeah, so I think it's so important because I talk to so many people that just think that sinus infections are just the cards they're dealt, right? It's just, I've dealt with them for years and that's just the way it goes. Or I've had bacteria vaginosis forever and I hate it.
Let's stay with the sinus infections for a minute.
Okay.
Let's just stay there. Why? Well, change your shower head, because the shower head is so loaded with bacteria. And some people go, what? What? Just Google shower heads and sinus infections. Just read the science that the shower head accumulates all of this bad bacteria, and you get in the shower and you turn it on and you get blasted with millions and millions of bacteria that have been hanging out inside the shower head in the biofilm of the shower head. I mean, there's so much to learn, but it's one step at a time. But I just wanted to do that one about the sinus infections because it's so common. Well, I've just had sinus infections forever. Well, that's not a genetic dictation that you've got, that you just have to have sinus infections. I've never had a patient that have sinus infections forever. I've had lots of patients with recurrent sinus infections, and they better not get any more infections if they're our patient, and they don't. Sometimes it takes a couple of weeks or a month, or sometimes in 4 or 5 months, they have one more bout, and then say, well, what happened? Well, nothing. What did you eat? Oh, there was a birthday last week and I had that birthday cake. I felt fine, but do you think that could have caused my infection 4 days later? And of course, the response is in the immortal words of Rosanna Dana, you think? And they go, oh, I'm not having any more cake, whatever it is. But all right, so that's the sinus infections one.
Yeah, so important. And sometimes people can get mark-ons or like a resistant staph infection, but let's start with things that are fairly inexpensive first. And I bought the 35% vinegar and I soaked my shower head after I think 3 months. I bought a new shower head, and then 3 months later I soaked it. Be sure to wear protective eyewear when you use that stuff. It is so strong. It feels like it's peeling the top layer off your eyeballs.
Why 35%?
Because that's what will really pull all the gunk and the LPS. Now, right. Gunk is the scientific term, right?
Right. That's the scientific term. The 6% stuff that you can buy in the supermarket does not work. It has to be 8% or higher. So you just go online to Google and you find out it's cheaper than the 6% stuff in the supermarket. And if you want the really good stuff, you get the 35%. But it's powerful. Not that it's going to hurt you, but as Michelle, just wear some glasses, but you take that shower head and you just soak it in that stuff, and it kills the bacteria, and it eats up the biofilm that the bacteria is hiding out in. And you want to do that about once if you're in a warm climate, every 6 months, every 3 to 6 months. If you're in a cold climate like Colorado or Illinois is most of the time, every 6 months to a year. is fine. You know, it'll take you a couple hours to do, but that way you protect you and your family from getting washed in bacteria every time you take a shower. Now, at this place that we're renting right now, there are 2 showers. And one of them, you turn it on and it just smells bad. You know, it takes about, a minute, then it doesn't smell bad anymore. And it took me until the second time before I realized. And when I realized, you know, I'm in the shower and I turn it on and I stand to the side when the water's going, oh man, this just smells. Oh, and I got out of there really quick because I understood what I was doing. And I went and I got my biocide and I'm pumping in my mouth and up my nose. I'm gargling with it, you know, because I just got blasted with millions of bacteria because I wasn't thinking. So now we don't use that shower because I can't order stuff here and all I can find is the 6%. And but you know, you'll learn this stuff as you start addressing it, looking at it. Mm-hmm. We have a few questions that have come in. You cannot trust all organic labels. The rules are they can still list themselves as organic if they reveal any pesticide treatments that have been done to the crops. Now get it from friends and families and small farms that grow, and you can grow spinach in the Midwest all through fall and winter. That's from Stefan Backhand Ravenfeller. You're right, Stefan, and thanks so much. You know, there is the ideal, and you're hitting right on it. And then there is better than normal, and then there's normal. So if all you have access to is organic, you get organic. But the ideal is to find a farm in your area. The ideal is to grow your own, if you can. Even on the balcony of in a condo, you can grow lots of stuff there. So, but what most people can do in the cities is there's cooperatives, and a farm will have a cooperative. It might be like $500 for a year, or $300 for a year, depending. And you get a box every week of whatever they're harvesting. So the box can have like 4 tomatoes and a pack of carrots and 2 heads of broccoli and kale and whatever it is that they're doing that week. And that's the ideal for people that can't grow their own. That's the best, and you go visit the farm. Maybe you take your kids on a Saturday and you go help out around there for a little bit, you know, pulling weeds or doing something, you know, get your hands in the dirt and all that kind of thing. But that's what I think is the ideal that supports a community to produce healthier food for all. So thank you, Stefan.
Know our farmers.
Yeah.
Visit those farmers markets, and yeah, the food delivery is great, especially if you don't go in and pick and choose ahead of time, because you get things you would never buy at the grocery store. And then
what am I going to do with this rhubarb? I don't know what to do with rhubarb. You're going to go on Google and you type in what do I do with rhubarb, and you find that you can make a great Jello with agar, the seaweed, agar, and it's or rhubarb pies, you know. Or, well, what do I do with a turnip? I don't know. Well, you'll learn what to do with a turnip, right? I mean, that's the way that we change the lifestyle. The definition of crazy is doing the same thing and expecting a different result, right? So obviously we have to do things differently, and you just want to learn a little bit every week of something different to do. Michelle, Kim asked where to buy that vinegar.
Amazon. I got it on Amazon.com.
Right. That makes it easy.
You know what? I bet you could go to like Ace Hardware. I love supporting the local hardware stores, and I get that that's a chain, but usually it's local people that are running it and having jobs. I just, when I bought it, everything was closed down. So yeah, look for Amazon if you can't find it locally.
And Luann says, I bruise all the time without hitting something. It's worse when I fly. I do have food allergies and use digestive enzymes. I eat well and take vitamins. Why am I still bruising? That's a really good question. And I don't know. There's many triggers that can set that off. One of the clues is that it gets worse when you fly. Well, what happens when you fly? It means 1,000 feet, the altitude's different. There's a little more pressure up there. Up there. So there's more stress on your body. And I mean, it could be nutrient deficiencies. I mean, you really want to have to explore that one. That's a person who I would do a SpectraCell test on to look at all of your vitamin and mineral levels. I rarely recommend that test, but you're a person that I would want to know how much vitamin A do you have, and vitamin E, and coenzyme Q10, and alpha lipoic acid. I want to know all of it because there is a dynamic going on, and it's not just one thing. There's going to be a whole lot going on in that one. That's something that, Luann, I would suggest you work with Michelle or a healthcare practitioner in your area that is trained in functional medicine. That's not a simple answer. That's not something that we can answer simply.
Right, but it's your body's trying to get your attention, you know, it's your way. And so often with these things, we kind of ignore it because we don't know what to do, or we take something to suppress the symptom. I mean, you can't take a pain medication to make bruising go away, but we let it go so long that eventually we get a diagnosis, right? And if you catch it now, where it's the symptom is not a disease, that's the easiest time to turn it around. Yeah, I was looking at all these, Dr. Tom, did you see all of these people writing down what their childhood foods were growing up?
Bologna on white bread. I did see that one. Me too.
Hang an Oscar Mayer bologna on white bread, hot dogs and Captain Crunch.
Oh, I'd love to be an Oscar Mayer wiener. That is what I truly like to be, because if I were an Oscar Mayer wiener, there would soon be nothing left of me. Right? I remember all those.
Three Musketeers and Mountain Dew. And when we think about this, and when you study biochem and learn all of these little intricate pathways in the body, it's amazing how often they work, because it can take years and years of that kind of abuse before something breaks down.
Yeah,
really,
agreed.
The human body is phenomenal.
Agreed. Amal asks a question, is there a clear relationship between toxic metals and LPS? Have a client with highest mercury levels I've ever seen on her Vibrant Gut Zoomer shows such high LPS. She's been organic, non-inflammatory, gluten-free for 10 years and is an intense long-term detox of her metals, including near-infrared sauna. Well, the first connection is intestinal permeability. Heavy metals will cause intestinal permeability. If they're free in the system, where's the exposure coming from? If they're buried in the system, not so much with intestinal permeability, but certainly blood-brain barrier permeability. If this stuff gets in the bloodstream, heavy-duty detox for long-term detox of her metals, including near-infrared sauna. Sounds like she's doing the right things. She should have some binders in there to absorb these metals in the bloodstream as they're coming out of storage. We all get exposed to heavy metals and they get stored in our bodies. Lead goes in the bones. That's why postmenopausal women have an acceleration in brain fog, is because if I don't want to go into a lot of detail about that, but if their adrenals are worn down from a highly stressful life, it's the adrenals that are supposed to start producing 1/10 the estrogen that your ovaries made. So when your ovaries shut down, when they're done with their job, the adrenals are supposed to kick in to make about 1/10 the estrogen. But if your adrenals are in a state of depletion and they can't do it, you now are estrogen deficient. And if you're estrogen deficient, you lose bone cells. And if you lose bone cells, those bone cells that are breaking down and not being replaced are often high in lead, because that's where lead gets pushed. So the lead gets into your bloodstream because your bone cells are breaking down, because you have an estrogen deficiency, because your adrenals are worn out. And the lead gets in the bloodstream and it goes to your brain and you get more brain fog. So people say, you know, I've got more brain fog. If you're a 62-year-old woman and you've got more brain fog, and then many docs are trying to give you supplements to deal with the brain fog, but you got to detox and you have to check and see, like, Amal is with this person that highest mercury she's ever seen. That means there's a lot of toxicity in there. And the correlation between LPS and heavy metals. I don't know of a correlation at the tissue level. Heavy metals will cause permeability, which allows more LPS infiltration. Michelle, do you have another line of thinking on that one?
I'm not picturing right now the direct correlation of those. I'm just thinking how critically important it is to make sure that that person has optimal mineral balance, because minerals can prevent the storage of heavy metals. So making sure that there's minerals and electrolytes in all the water that they're drinking, making sure that there's optimal minerals. And then I would want to monitor blood-brain barrier permeability on a NeuroZoomer Plus, just to make sure that whatever you're doing is not driving some of this across the blood-brain barrier.
Right, right,
I know
right.
that Amal is knowledgeable about that, but maybe not everybody is. And I think that's so important when there's toxic metals to really make sure it's not getting into the brain.
Right. And for those that have water filtration systems in your home, way to go. That's a really good thing to do. If it includes reverse osmosis, you need to understand that your water is mineral deficient. And so if reverse osmosis is a really good thing to get all the crud out of your water. It's one of the 3 components of a good water filtration system that I'm aware of. But it takes out the good metals too, or the good minerals. It takes out the metals, but it takes out the good minerals. So you have to have a good mineral supplement that you take as compensation for losing the minerals in the water. You're not getting minerals in the water. Okay.
Yeah.
Barbie asked New Year's with a question mark. Oh, the baby? Oh, thanks, Barbie. It's the due date's December 24th.
Christmas, so, a little Christmas present.
A little Christmas present. Mia's here from North Wales. Hi, Mia. Laura says 500, Laura Foster, 500 or 5,000. And I think she's referring to Daltons, the size, and it's 500 Daltons. Nothing over 500 Daltons is supposed to get in. Anything smaller than that gets in easily. Okay. Michelle, were you going to say something there?
Yes. Timothy Getz says, do you recommend any type of medication to treat LPS?
I was going to be cute, but I'm not. No. Well, if you have symptoms and you can't function very well because of the symptoms, you do what you have to do so you can function. So if you need some medication for migraines or for depression, which easily can come from LPS accumulation, if you need some medication, absolutely, you take the medication. But at the same time, you're dealing with, why do I have migraines? Or why do I have depression? And I've got elevated LPS, how do I get this stuff out of there? So you deal with it at the same time, but there's no medication that's going to act like a sponge to suck that stuff up. You have to be more active and aggressive than that. That's why we're doing this study right now that we've just launched. And, you know, I haven't closed it yet. I need to really soon, but I'll tell you guys about it if you're interested. We're doing a study where people do the test, and somebody asked, what's the test to do for LPS? It's the wheat zoomer. It's a component of the wheat zoomer is where you look for the antibodies to LPS. And, you know, I'll wait a little bit to talk about the study. We'll talk about it here, but let's continue with the questions right now. I don't know of a medical term, brain drain, you know, but I think what you mean is that you feel fried and there's just no juice in your brain. There's no juju, you know, to do your day. And so it's beyond brain fog. It's just, there's a whole lot of, I don't wanna. And I assume that's what brain drain is. And absolutely, it's associated with that. That's just an inflammatory state, which probably set up a imbalance in the number of, in the concentration of nerve hormones you have called neurotransmitters. And you've heard me say this before, for every one message from the brain going down telling the gut what to do, there are 9 messages from the gut going up telling the brain what to do. And what are those messages? How much neurotransmitters to make, how much serotonin, how much melatonin, how much norepinephrine, how much brain-derived neurotrophic factor. All of these really important hormones and nerve transmitters in the brain are controlled, hands on the steering wheel, by the good bacteria in your gut. So anyone that has a brain drain or brain fog or brain dysfunction, anyone and everyone needs to include as part of your protocol, rebuild the good guys in the gut. Critically, critically important. Michelle, do you want to add to that?
Yes, and it's not as simple as shotgunning probiotics. Sometimes I wish that it was that simple. I'd be out of a job. I'd have to find a new passion, but everybody would be well, and that'd be okay, right? But it's just not that easy, and not every probiotic survives the acidity of the stomach, right? So remember, food is our medicine. So every meal is just an opportunity to eat vegetables, right? Vegetables can ferment in the gut and help to feed the beneficial flora, but fiber is so key with feeding the good bacteria in the gut.
And everyone knows who follows us here regularly, we've talked a number of times of how do you rebuild the good guys in the gut. So you can go back to one of the earlier Facebook Lives and go through it, the 5-step process. And it's helpful to take a probiotic supplement. We always recommend that for a couple of months while we're changing the lifestyle so that you're feeding the good bacteria in your gut from your food selections. But for a couple of months to take it, it's a good idea. But
no, I'm not saying the probiotics are not good, Dr. Tom, but I don't think we can just shotgun with just any random, because if somebody has an overgrowth of lactobacillus and they're shotgunning billions of lactobacillus into their gut, that can just exacerbate things. So I think it's important to test, don't guess, right? And it's not as simple as just taking a random probiotic off the shelf and it's going to fix it all.
Right. Agreed. Now, when I came out in practice 40 years ago, but it's still a hard thing to say, 40 years ago. But in 1980, we shotgunned probiotics, and people had never heard of these things like Lactobacillus acidophilus and Bifidobacterium longus. They'd look at me, they'd tilt their head sideways that I was speaking Greek to them, right? But we would shotgun and people would get better as a component of the treatment protocol. But now, back then, we didn't know what prebiotics were. We had no idea of the importance of food selections to all of this and how critical it was who's got their hands on the steering wheel. Now we know it's the number one health topic that a family needs to address is who's got their hands on the steering wheel of where this body is going. And it's the microflora of your gut. It's the bacteria and viruses in your gut. Yes, I use the word viruses. We have millions of viruses in us. I'm not exaggerating. And in the years to come, like you now hear about the good bacteria all the time, you'll be hearing about the good viruses because there's lots of studies coming out about them. But there's a bad guy right now, and the evidence is pretty strong that it's man-made, this bad guy. That is the scourge of the planet right now. But you'll hear more about bacteria in the years to come and how important they are, and viruses, how important they are also. You'll hear about that. Okay.
I have a couple questions, one from Carol and one from Emily on how to find out if you have LPS antibodies, what tests are available. And then Catherine wants to know the difference between wheat Zoomer GI maps and ELISA testing.
Okay, that first question, Eddie, let's post the link to the wheat Zoomer at our website. And you can go to that link, you can download the information, take it to your doctor and ask them to order the test. Most of them won't because they don't know what the test is and they're not going to do what you asked. They're the doctor. That's how they think, and they won't review the literature on it to find out it's the best test in the world. Literally, I teach all over the world, and there's nothing like this anywhere else. And if your doctor won't order it for you, order it from our website. we've set up a system so that you can get it there. We'd much prefer that you get it from your doctor so they can learn about all this, but it's most important that you have access to the right tests. So you can get it there. What was the second part of the question, Michelle?
So the next question was, what's the difference between wheat Zoomer, GI maps, and ELISA? So that may be a longer answer.
Yeah, no, real quick answer. You judge the benefit of any laboratory test by the sensitivity and specificity. Those two geek terms are really important in terms of how accurate is this test. There have never been tests before in this world. Never has there been an ELISA test that has 98 to 100% sensitivity and specificity. Never. And there won't be, because the technology is from the 1990s. ELISA is really good and helpful, but many times the sensitivity is in the mid to high 70%, and the specificity is in the high 70s to mid 80s, meaning it's wrong 2 or 3 out of 10 times. And that's what I came into practice using those tests. They were cutting edge in the 1990s and in the early 2000s. But the new technology that Mayo Clinic writes, and this is their language, a new era in laboratory medicine, is 98 to 100% sensitive and specific every single time. That's the difference with the Zoomers. And I now have 8 papers, 4 of them from Mayo Clinic, 1 from Columbia, and the others I don't know where they're from, on the accuracy and the sensitivity and specificity of this technology called silicone chip technology. It's a new era in laboratory medicine. And so that's the difference. The other tests are good, very good. If nothing else is available, for example, in Europe, they can't get the Zoomer panels yet. And so if they can get good ELISA tests like Cyrex, it's great. You know, they're going to be helpful tests, but there's nothing like these Zoomers.
We can ship them. They just have to email testing at theDr.com, and they have to pay in advance for the shipping too, and back. It includes the shipping back to the lab.
Right. That's right. So
and they have to find their own phlebotomy in, but it can be shipped too.
Great. And now, if you're outside the US, I don't have a person working for theDr.com that I'm paying hourly to figure out what your mailing costs are going to be to France or to Italy. We don't, it's different in every country. The laws are different in every country, and that's not our area of expertise. We're happy to help if we can, but we've had a couple of people that got really upset and wrote nasty emails because my team couldn't figure out how to get them the test in Spain. And I'm like, sorry, it's not our area of expertise. So we'll do our best to help you anywhere in the world if we can. But please be kind to my staff. People that are not nice to my staff, please be kind to my staff.
Thanks, Dr. Tom. I have a sample report pulled up, and I'm just such a visual learner. And I'm just going to share what this panel looks like so that you can see. This is the intestinal permeability panel. Here's the LPS. We're looking at IgA and IgG and IgM combined. You can see this person has elevated LPS, significant intestinal permeability.
More than double, and that's a lot. That's a lot of antibodies that the immune system is fighting really hard because there's too much of a problem here. Now that person almost assuredly has a microbiome that's an inflammatory microbiome. It's tearing the cheesecloth constantly. And they go gluten-free, which is often required. The rest of the test would show if there's positive markers for wheat there, but they go gluten-free, but they're still eating inorganic, or they're still doing dairy, and they've got a sensitivity to dairy or to corn or something else. that also can tear at the cheesecloth. That's why we have to be comprehensive when we're dealing with something. And this is not good. This test result is absolutely not good.
No, because the IgA is only 2.1 points from the reference range, and this anti-actin IgA is only 9/10 away from the reference. So
right. So
within range, it's still high normal.
Right. And that's a person on the way to sepsis. If that were to continue, if they didn't do that blood test and find this out and start to take action, that's the mechanism that over many years, and this person may not have gut symptoms, but over many years, the LPS keeps going in, the immune system's trying to fight it because you've lost tolerance, there's way too much of it, and your immune system's overwhelmed, but there's more LPS coming in, it accumulates into your kidneys, it accumulates in your brain, it accumulates in your lungs. A paper came out last week from one of our mentors, Professor Schoenfeld, the godfather of autoimmunity. He published a paper with 9 other world-renowned immunologists. And so 10 world-renowned immunologists, 6 of them chair departments of immunology in med schools or hospitals in Spain or France or England, US. And what they talked about is the amount of LPS in the lungs of these people that get a cytokine storm. And they're associating the environment of this person's body with being vulnerable to a cytokine storm, which is what's killing people in the hospitals with this virus. And it's usually very quick. It's within a day to 2 to 3 days, just like the 1918 flu. The same thing happened. It just took, I think it was up to 5 days back then, is setting the stage for that. They've got all this toxin that's been accumulating for so many years. And you've heard me talk about many of these patients are low in vitamin D and how important zinc is and quercetin, and all of that is all very true. But the tissue is just so toxic, and they've crossed the threshold, and they don't have the reserves to keep it in check. And what happens is this cytokine storm. So it's so important that all of us learn how to include a little bit of detoxification support in our lives and the lives of our children every single day. The first thing on that, of course, is drink enough water. You have to have a ½ ounce of water per pound body weight. That's the minimum in order to be able to get rid of the toxins that your body's exposed to. If you don't have that, it's like you back your car into a snowbank and the exhaust pipe's all full of snow. Where's the exhaust going to go, right? If you don't have enough water to just flush this stuff out, where's all these toxins going to go? They accumulate in your tissue. And that's one of the mechanisms behind why we have so much of an increase in the number, in the size of fat cells for people. Why people are carrying so much extra nowadays, part of it is because they're really toxic. And the brain says, get this stuff off the highway, get it out of the bloodstream. So where's it going to go? It's going to go into storage. And where's the storage cells in the body? The fat cells. So these are people that are really counting calories and they're trying to be healthy. You know, they're trying to watch their weight, but they keep their thighs and their waist. They just keep getting a little bigger, and they're watching their calories. They're toxic. And the toxins are being pushed into those cells.
Body's doing its best to protect the essential organs.
Right. Exactly right. Exactly right.
Marco asks, I have long-term, back to the water thing. And it's also so important that you have enough electrolytes in those water to get the water into the cells. Yeah. For those sodium, potassium, magnesium pumps on the cells. If you don't have that, then the water can't get into the cells and it just goes right through you. I don't know how many people I talk to and I say, if you were to drink 16 ounces of water really quickly, how soon before you would urinate? And they're like, oh, I hate drinking water because I drink water and I pee it right out. Well, probably because the water isn't actually getting into your cells. So you have high extracellular fluid and low intracellular fluid. So those electrolytes, those minerals are so key. Okay, Marco asks, I have long-term disabling mental and physical symptoms, severe depression, anxiety, brain fog, etc. How can I know if I have leaky gut or autoimmune diseases?
Really good question, and really good question. And thank you for being here and watching this. And sounds like you're really battling right now. And high five to you for being willing to be in here and make that declaration. So high five to you. Come on. Good. Okay. Now, you need a coach. You need a coach who's going to walk you through the step-by-step process and knows what they're doing. I'm not going to be shy here. Your life is on the line. The quality of your life is on the line. Work with Michelle. Work with Michelle. It might be once every 2 months you're going to work with Michelle and get some coaching, but give her a chance to set up a plan for you, because there's no question in my mind that you've got intestinal permeability. I would wager on it. I'd wager $1,000 that you've got intestinal permeability, and probably LPS infiltration also, probably. But those are just the mechanisms. Fixing them is what's important. So the first thing you want is to be able to identify, I've said this many times that my favorite patients are the ones that say, I've been to Mayo Clinic and they don't know what's wrong. And I say, that's great. Michelle's the same way. She does the same thing. Oh, that's wonderful. People go, what? What? So that means you don't have a disease. If you had a disease, Mayo Clinic would find it. You've got dysfunction. Something's not functioning right. So we're going to do functional tests to see what's not functioning right. And when those tests come back, you want the doctor to say, you want Michelle to say, well, your test results are back. Good news. You're a mess. Look at all these things that are out of balance. This will take 2 months. This will take 6 months. This will take about a year. This should be better in a couple of weeks. But look at all these things that are all correctable. You're out of balance. So we got to bring the balance back into your system again. You want someone that's going to look at your overall health that way. Not say, well, here's a drug you can take that'll help you. Nonsense. Utter nonsense. Now, if you need the meds to function right now, of course, be smart, take the meds, of course. But you can't live on the meds. The meds are designed for short-term use. What you need for long-term benefit is to change the lifestyle that's causing the problem. Here's an example. You can be gluten-free, dairy-free, sugar-free, doing everything we talk about, soaking your shower heads in 35% vinegar every 3 months, doing all these crazy things that your friends think you're a nutcase to do, and not be any better. Because you got mold in your house. And you don't know that you got mold in the basement. You think you're fine. But I tell the story often. I had the CEO of a big bank fly to California to see me. He wanted to send his jet to take me back to, I think it was Minneapolis. I said, no, I'm not going back. I don't have time for this. And so he and his wife flew out for a couple-day vacation in California, and they came to see me. I didn't have an office. And so I met him at a coffee shop. And because the guy heard that I was a diagnostician, and I met him at a coffee shop. It took me 3 minutes, maybe 5 minutes after sitting down with a coffee for me to ask him, so when did your basement flood? How did you know my basement flooded? When did it flood? 2 years ago. And when did your symptoms begin? About 18 months. You think that's got something to do with it? Go home and have them knock out a little bit of the drywall in the basement and see if you don't have mold on the other side of the drywall. Because when your basement floods, if there's a leak or something and there's this much water in the basement and you get the water out of there, you bring a dehumidifier down there and a big fan to dry everything out so the drywall dries out, but the backside of the drywall can stay wet, mold can grow there, and those spores get into the air and you're breathing mold that goes right up to your brain, causing depression. And you never know because you can't smell it, right? That's why you need someone who knows what the hell they're doing, And if you aren't better within a particular length of time, we have to do the David Jones routine. Dr. Jones, the president emeritus of the Institute for Functional Medicine, tells this story so many times. He'd go into a room with a patient and say, so how are those symptoms that you came in with last month? And the patient says, I'm no better. And Dr. Jones is a little startled and he looks and he says, have you been doing this? Yes. Have you been doing yes? Yes. And have you been taking the supplements? Yes. And are you taking the antidepressant? Yes. And yes. So you're doing everything we said. Yes. You're not lying to me. No, doc, I've done everything. Well, I see in your eyes, you're telling the truth. Excuse me. Closes the file, walks out of the room, closes the door, takes a breath, walks back in the room and says, hi, I'm Dr. Smith. Dr. Jones asked me to help to take a look at your case because he doesn't know why you're not better. So let's start at the beginning. And he takes the history again because he missed something. That you do what a good certified functional medicine practitioner recommends you do, you should start feeling better within a length of time. And you call them out. You say, well, how long before I'll notice a difference? Well, it depends on it. I know it depends, doc, and I'm not holding you to it, but I mean, it's going to be 6 months before I notice. No. Certainly within a few weeks to a month, you should notice. And so there needs to be a timeline on everything. We need to hold our healthcare practitioners accountable. And if our healthcare practitioners can't give you an estimated time, then they're not sure what's going on for you and they're shotgunning. So excuse me, but if you've seen the YouTube commercial, the little clip, the YouTube clip, Ain't Nobody Got Time for This. And if you haven't seen it, you have to go watch it after this. Just go to YouTube and type in Ain't Nobody Got Time for This. It's 3 minutes long. And ain't nobody got time for this. You ain't got time to go to a healthcare practitioner who's going to drag you along and hopefully make you feel better or help you feel better, hopefully. You want someone who's going to say, these tests will hopefully give us the information we need, and these are the most important tests to do. And when they come back, here are the problems that you've got. This should correct in about, if you follow our guidelines, it should take about this amount of time. There's no guarantees, but there needs to be some accountability. And so that's how we are here at theDr.com. And it's consultations at theDr.com. And, you know, I'm not a walking advertisement here for this, but I'm getting tired of people staying sick and they're trying to do the right thing, but somebody didn't check what should have been obvious to a certified functional medicine practitioner. So excuse me for going off there a little bit. Michelle?
It's okay. You can get on your soapbox. We care about people, and it's so true. You know, when we partner with somebody for their health, it is a partnership. And if we go through and can't find it, and we can't find it the second time, then referring out is so critically important. Let's get another person on the team, another brain, right? But if somebody just keeps going back, you're a chiropractor too. You just didn't have people just coming back week after week after week with, you know, with the same issue. Nope. You just don't want to be in this constant cycle of sickness.
Often had musculoskeletal patients that would get better and then it would come back. It would get better and then it would come back. You say, all right, well, let's see what it is about your lifestyle that's stressing this joint and making this thing come back. And so then you got to go look and you find out that their car seat is tilted and they're driving like this. And, you know, so their necks are out way like this in front of their shoulders. And if you sat up with the neck like that, it's out there like this. You know, there's always something. So if you get results and it comes back, you just have to peel another layer of the onion. You got to go a little bit deeper to figure out what's causing that. Mm-hmm. All right, everyone. It's 6:06 here, 5:06 Pacific, 2:06 in Italy, 9:36 in Australia. Facebook Live, it's been another, gosh, it goes so fast, session. So thank you all so very much for joining us. Love doing this, love being a part of this with you, and love doing this with you, Michelle. It makes it so much
wonderful.
fun.
Yes.
Yeah.
Sending lots of healing love to everyone.
Yeah. Take care of yourselves in this crazy time, and we'll see you next week. Bye-bye.